Why does your groin pain keep moving around? In this video, we're going to go through the different types of groin pain and why it's relatively normal to feel it in multiple areas. We'll explain why that happens. We'll go through the tests that we use here in clinic and then talk about the approach that you need to get rid of all this. Hi, my name is Tommy Brown of the Pain and Performance Clinic based in Lucan in Dublin. So this particular injury can be very frustrating for people, hang on way too long, for weeks, for months and even for years. Some people carry it on from one season into the next and can never really get to the root cause of it. Look at our other videos for the exact exercises that you need to do to address that. But one of the frustrations and the confusing thing that people have for both clients and therapists is that the pain can move around from different locations. So the reason for that is this is an injury that generally affects this pelvic area. So you have adductor related groin pain and your adductor muscle comes up and attaches right here. You also have hip flexor related groin pain. You have inguinal related groin pain and you have pubic related groin pain. So you might hear names like Gilmore's groin, athletic groin pain, pubic symphysis, osteitis pubis, lots of different names, which doesn't help with the diagnosis of it all, but it's actually relatively normal that you would often have issues in more than one area. All these muscles are attached to this pelvic area, and for people involved in running, accelerating, decelerating, twisting, turning, it's very common that in clinic, by the time people come to us, they would often have that issue in 1, 2 or 3 of those general areas. So we'll go through some of the tests now here with Aaron as to how you might identify which area is most problematic for yourself. So if we start in identifying adductor related groin pain, so the adductors go along the inside of your leg down towards your knee right up to your pelvis here. So the first test we would use is going with a squeeze here, okay, and these would elicit either pain or weakness or a little bit of both. And squeezing here. Then what we might do is just keeping your leg relaxed, we'll bring it all the way out and then bring that leg back in, and obviously you compare on both sides. And then the final test here will be in this 90-90 position, and again give it a squeeze. So lots of those tests can elicit pain along this area here, which would have it as more adductor related groin pain. If we go into this test here, so push, and obviously you would test one side and then compare it to the other side in terms of both weakness and pain, and you might get some pain either in the groin, but maybe along this inguinal crease or up into your hip flexor. If we want to identify more abdominal related pain, just go and do a sit up and back down, and then just sit up and hold, and resisted sit up there and take a break. And again, that might reproduce pain more along the abdominal area here. Something else that might happen for a lot of people suffering with this is that they have pain coughing and sneezing, which again would indicate the abdominal area being involved. In terms of then the pubic area, there can obviously be a lot of pain and tenderness down here. With the heel of your hand, you can come down and palpate the pelvis and assess one side to the other and see what that's like. So for people suffering with this condition, they can have pain here, they can have pain here, they can have pain along here. That's normal in this condition. The treatment approach overlaps pretty much for about 80% of it. So it's not always crucially important that you identify the exact structure, but it is a part of it. What I mean by that is you're going to do 80% of the rehab you do for this is going to overlap. To strengthen this up, you're going to need to address adductors, hip flexors, abdominal area. It's just that if it's more adductor related, you might put a little bit more focus on the adductors. If it's, for example, abdominal related pain is included in that, you would definitely have to add in some more abdominal work than you would if it was purely adductor related. So to summarize, in terms of this ongoing groin pain, you can really categorize it into 4 areas, but rarely is only one area involved. It often lasts for a long time with people. The nature of it is that the pain comes back in maybe when they train again, but after training, pain is sore, subsides for 2 days, so you get to kind of train and play away. After a while, you notice your pace reduces, you're not able to go. Usually this warms up with activity, and what happens in the end is it takes longer for it to warm up, or you just never actually get forget to really let go with it, and it's generally deterioration as time goes on, to the point where you just can't play your sport. You can't do the training that you need to do. Most people rest it and get soft tissue treatment and get it scanned. The vast majority of people will improve and get this sorted with a comprehensive strengthening program of this entire area. If you want more help and support on that, comment below or look at our other videos and we'll be happy to help.